this briefing with some opening remarks from Tina Fries-Decker, our Spectrum Health President and CEO. Then we'll hear from Dr. Daryl Elmucci, President of Spectrum Health West Michigan, and then turn over to John Ashford, who is the Chief Operating Officer of Spectrum Health United and Kelsey Hospitals, and our operations leader of our vaccine clinics. And then we will open it up to you, the media, for questions. Please place your questions in the chat. We will call on you to ask your questions live, and then we will answer them as time allows in the order that they were received. So with that being said, I'd like to turn it over to Tina to get us started this afternoon.
Thank you so much, Carrie, and good afternoon. Thank you for joining us today. You know, I'm reflective of 1 year ago, we all entered this unimaginable time. None of us could have anticipated the severe illness, the loss of life, and acute loneliness that's been created by this pandemic. And so we all mourn and grieve those that we lost, and we also share compassion with those who struggle. The challenges that we've faced are immense, but through it all, our teams and our community's sense of purpose and support has been unwavering, and we thank you for that. I am incredibly proud of our team for caring for our community. They have exemplified courage, curiosity, collaboration, and compassion every day with every interaction. And I'm also grateful for our communities for walking alongside us, supporting us, and heeding our messages regarding the importance of the prevention measures. And so today we need your help again, because at present we are seeing a concerning increase in COVID-19 positivity and people with COVID-19 in our hospitals. For Michigan, the 7-day average positivity rate is now about 11.8%. And across Spectrum Health System, our 7-day average positivity rate is 12.8%. So we need to treat this surge seriously. To protect everyone in our communities, it's critical that we continue to practice those safety preventions. Wearing a mask, they do work, washing your hands often, and being socially distant. Another important piece of prevention is getting the COVID-19 vaccine. And today, we are expanding eligibility to people aged 16 and up. And in this latest surge that we are seeing, it shows the benefits of being vaccinated. People showing up in our hospitals with COVID-19 are significantly younger on average than during the fall surge, and we have yet to care for someone who has been fully vaccinated. On our teams and in our communities, the vaccine is working. In collaboration with our health departments and community partners, we're providing many options and locations to get the vaccine, which you'll hear about in a few minutes. We need to make sure we're keeping prevention top of mind until everyone has an opportunity to receive this vaccine and we can reach herd immunity. So I'd like to ask Dr. Daryl Elmucci to provide more details on our current state with COVID-19. Daryl?
Thanks so much, Tina. And before I start, I'd just like to wish all of our doctors and all the doctors across West Michigan and our state and our country even happy Doctors Day. It's been quite a year, and this is the one day a year where doctors get celebrated. So thank you all. I'll now kind of dive in a little further with what we're seeing. So I had a chance to round in some of our hospitals today, and this is strangely and sadly reminiscent of what we felt in the fall, namely that over the last 1 to 2 weeks, we've really seen our inpatient admissions jump up dramatically. As a matter of fact, the slope of that curve, or the increase, is actually a bit faster than we saw in October, November timeframe. Just about 2.5 weeks ago, we were sitting in the low 50s across our whole system with a number of inpatients with COVID-19. As of an hour or so ago, we're up to 139. So we've really come close to tripling where we were just a few short weeks ago. The positivity rate that Tina mentioned is being felt. On a given day, we've had highs of up to 16% positivity, and that's in spite of markedly increased testing because so many more folks are symptomatic in the community. One thing we were hoping would be a bit delayed was ICU status, or more people needing ICU level care. And unfortunately, over the last 4 to 5 days, we've now seen a jump up in our ICU census of COVID patients. Those numbers are still far lower than we saw at the worst, which for us was right around Thanksgiving, but nonetheless on the rise. So as Tina mentioned, definitely a younger demographic in the hospital, definitely a lot of positivity and a lot of concern that what we're seeing now feels strangely reminiscent to what we saw just a few short months ago. Now, with that said, as Tina mentioned, there is hope, and that hope really lies almost entirely with the vaccine for the future. And I'm really proud to report that yesterday at the West Michigan Vaccine Clinic, which is a clinic done in conjunction with Kent County Health Department, ourselves, Mercy Health, and others, we vaccinated over 12,500 people in 12 hours yesterday at this clinic. As best we know, that is a record across the United States of the single highest throughput clinic across the country. And this week we have scheduled across all of our clinics 52,000 doses between first and second doses that will be administered throughout West Michigan. So this is how we will get through this. Our hope is that we get more and more vaccine over the coming weeks and months, and that's really been the limiting factor. And as Tina mentioned, effective immediately, we are decreasing eligibility, or enhancing eligibility, I should say, across all of our clinics administering vaccine for everyone 16 and older. And I'm also happy to report that earlier this week, we changed our process to make it even easier for people to schedule. Now, via the web, not only can you get online to coordinate your vaccine, but you can actually schedule your vaccine based on the clinic availability, the day and the time, and just show up and we'll vaccinate you. So our goal is to put as many shots in arms as possible. Our goal is also to care for all of those coming into our hospitals. And we definitely hope we don't see a surge like we did before, but it's feeling that way. With that said, I'd like to turn it over to John Ashford for a bit more about our vaccine efforts.
Thank you, Daryl. As Daryl alluded to, yesterday was a great day for Spectrum Health State of Michigan, where we were able to deliver 12,500 vaccines at the West Michigan Vaccine Clinic. Overall, we have delivered over 145,000 first doses, and as well as 82,000 second doses. Understanding no one clinic meets the needs of all our communities, we are offering a wide variety of clinics within the Spectrum Health system. We have hospital-based clinics in our regional sites. Obviously, the West Michigan Vaccine Clinic, our largest clinic, is still up and going and thriving. We have drive-through options at 1300 Michigan, as well as a home-based primary care where vaccines are brought into the homes for those individuals to receive. And lastly, we have our targeted clinics where we are really targeting on the social vulnerability index for those individuals who have been underrepresented, underserved, and hit hard by COVID. To allude a little bit more in our special clinics, we continue to ramp up at New Hope Baptist Church. And recently we also launched Cesar Chavez Elementary School in partnership with Grand Rapids Public School and the Kent County Health Department. Our SVI targeted clinics, we have delivered over 8,000 doses in those targeted clinics. And as you can imagine, that's truly breaking down the barriers, the hesitancy, and really alluding to everyone coming through who have transportation barriers and all that sort. So we're really truly delivering the vaccine to those communities where they feel best it can be received. And lastly, I'd like to allude to our earlier in the month of March, we had our Faith Leaders event, a grassroots events where many denominations and faith-based leaders came together at the West Michigan Vaccine Clinic to truly volunteer, garner support, and once again, reduce the hesitancy within those communities and within those groups. It's been a phenomenal support, and we will continue to leverage our informal leaders and our community leaders and our influencers within the community to make sure we all can get through this together, and once again, have a vaccine for each and every constituent that wants to receive one. Carrie, back to you.
Thank you, Tina, Daryl, and John, for those opening remarks. We appreciate it. Just a reminder to the media, please go ahead and put your question in the chat, and we will turn to your questions at this time. I'd like to first open it up to Alana Holland for the first question.
Yeah, hi. The younger age group being able to be vaccinated, that vaccine eligibility, is that in response to seeing that younger age group being hospitalized right now? Is there a connection between that?
I can take that. So the answer is yes, and so ultimately, as we're seeing younger folks being hospitalized, we all recognize, as does the state, that the more vaccine we get into younger folks, the better sooner. So that's a big part of it. The other part is we just wanted to simplify for everyone. As you recall, the governor made an announcement just a few weeks ago about a slow, steady march to opening it up to all 16 plus in the state. That was scheduled for next Monday. But then last night she came out, as did other state officials, saying, let's do this even sooner. Let's try to be quick and easy about it. So we are doing exactly that. And it's now much simpler to just get scheduled, bring your kids to get scheduled. My wife signed up my 17-year-old son, and I can't wait for him to get the vaccine.
Thank you, Daryl. Let's turn it over to Emily Leonard.
Hi, thanks for taking my question. Wondering about if you guys are seeing more Miss C cases with the numbers being higher in the younger age groups.
A lot of these are doctor questions, so I get to take them. So the answer is yes. Over the last 2 months, we've had a number of Miss C cases in our hospitals. And for those that don't recall, this is the inflammatory condition that can occur primarily in kids, usually a few weeks or so after a COVID infection, even if it was asymptomatic. We've seen increased amount of pediatric patients with active COVID in the hospital, and we've seen a number of Miss C cases over the last couple of months. We did see these early on as well, but this has been a greater amount in the recent months.
Great, let's go to Mark Sanchez.
Hi, good afternoon, and thanks for your time, everybody. Curious, how's the availability of doses, shipment of doses from the state been trending the last few weeks? And what do you expect to see in the weeks ahead? I think, can't remember the number that was on the state's dashboard this afternoon, but looked like it's been going up considerably the last 2-3 weeks.
I don't know if Tina or Daryl, if you want to take that, or maybe that's.
I wonder if John might actually be best in terms of the doses.
Yeah, I can go ahead and take that. So we have been seeing an increase in allocation from Spectrum Health, but I will say that's more so going to the health departments, and the health departments are then allocating it to Spectrum Health, which we've been delivering in on many of our vaccine clinics. I will say still that the receival of vaccines, their allocation is still very sporadic. While we, as Daryl alluded, we're going to be delivering over 50,000 doses this week. It was quite the contrary last week. And so we have not seen, I would say, stability in the amount of doses that we're receiving, but we are optimistic where we're going to continue to receive the volume that we have, hopefully this week, and continue to leverage and partner with our local health departments to truly get the vaccine as many arms as fast as possible.
How many doses did you get this week?
Total doses, we had a rough 52,000 that was shared between us, allocations to Spectrum Health, and those are allocations that we receive from the health departments also that end up allocating to us to deliver.
Thank you, John.
And if I could just add to that, I think John said it well. This has really been amazing collaboration between local health departments and many of us in healthcare. We've been using doses together, contributing together, and I'll also give kudos to the state because we've explained the ability we have here in West Michigan to really deliver a high output of vaccines very quickly, and they have been listening to us. And this week was a great example where we got a much bigger allocation than we had anticipated, which we put to good use. So we hope that continues.
What we care about the most is that shots are in arms. And so it doesn't matter where you get your shot, your vaccine. We think it's just important that we're all collaborating to help our community.
All right, great. Let's turn over to Dustin Dwyer for your question.
Yes, hello. I want to ask about the L word. Should we be in another lockdown? Should we be scaling back anything? And in particular, I'm curious about your thoughts, given that spring break is coming for many schools here in West Michigan. What's your advice? What would you like to see?
So I think that we all need to continue to practice what we know actually works. Wearing our mask, washing our hands, and being socially distant. I know that this can be tiring to do so, but it is proving that that actually does work. I think we should be mindful that the positivity rate is increasing, and with our experience last fall when the positivity rate increased at this rate, it was very concerning. But we also know that our community came together when they saw that increase go up, and they, all our community members modified their behaviors, wore their mask, washed their hands, and limited some of their engagements to really make sure that this doesn't spread. And so that would be my advice.
Thank you, Tina. Chad, Livengood, let's go over to you.
Yes, I came in a little late here. How many current patients with confirmed cases of COVID are there in Spectrum Health hospitals today or this week versus a week ago and 2 weeks ago?
Sure, I'll recap that. So as of a few minutes ago, we're at 139 inpatients with documented COVID-19 infections. That contrasts to about 2 weeks ago, we were sitting in the low 50s. I believe 52 was our low during this kind of period since the last surge. So we've really almost tripled in just a couple of weeks.
Alana, we'll go back to you for another question.
Yes, hi. We've been talking about the positivity rate and hospitalizations. Are deaths also seeing an increase at Spectrum Health? And are you still using the ventilators as frequently? I know earlier in the fall, at the beginning of that surge, we weren't, as much use of the ventilators at that time. What are we kind of seeing as far as those two things?
Right. So, sadly, this feels strangely familiar and a bit predictable, where you first see the positivity rise, then there's a lull, and then you start seeing hospitalizations, another lull, and then you start seeing ICU admissions. We're just hitting that ICU admission phase now. As I mentioned earlier, our ICU admissions, actually, they've doubled in 4 days. Still manageable numbers, but much more than we had just a few days ago. And sadly, what is generally to follow, if past experience were to tell us, is that in a week to 10 days, we'll start seeing an increase in deaths. And once people do get to the ICU, that's generally for ventilator type care. Now, the differences now than in the past are twofold, really. Number one is that a lot of older people, particularly nursing home residents, are vaccinated, and that's why we're not seeing nearly as many in the 70+ range that we saw before. So we're very hopeful that younger people that are by nature healthier might not progress to needing ICU level care, needing ventilators and dying, although we don't know yet. But number two, what's working against us, and I'm sure you're all covering elsewhere, that the variants, particularly the UK variant, is increasingly common in the state of Michigan. And that is likely, we know actually, is much more contagious and more lethal. So all of how these balance out and what we ultimately see with deaths, we just don't know, but we're obviously very concerned.
Okay, let's go to Chris Hall. And if you could introduce yourself and what media outlet you're from, I think that would be helpful as well. Thank you.
Yeah, hi, Chris Hall with the Detroit Free Press. I wanted to find out if you guys have reinstated visitor restrictions. I know some of the hospitals on this end of the state have, and generally what are those? And then what is the average age of COVID inpatients right now? And you touched on this a little bit. What is contributing to the surge you're seeing?
All right, I guess I'm going to take this one too, if my colleagues don't mind. So first of all, as far as visitor restrictions, actually effective for us tomorrow morning at 6 a.m., we have increased our visitor restriction policy. We are allowing one, essentially every adult in the hospital can have one visitor. Our obstetric patients and our pediatric patients can have two. In circumstances where there's a true need to have more visitors because of end-of-life care or extenuating circumstances, we also allow that as well. This is a bit more liberal than our policy was earlier on because we've learned so much more. Our PPE stockpiles are so much better, and we obviously have access to the vaccine. Our goal is to continue like this as long as we can, as opposed to locking down completely, but the circumstances on the ground will tell us that. And then can you, your second question, can you share just once more?
Well, yes, the average age of COVID inpatients and what is contributing to the surge.
Sure. So our average age in the last surge was 73 years old, and our average age currently is 60 years old, and that fluctuates a bit. And quite honestly, as I mentioned, all of this is a bit of speculation, but we're looking at the numbers, particularly of the 70+ group, and we've seen those numbers decline as a percentage of the overall COVID admits substantially by over 40% compared to the last surge. And we're seeing the numbers for those under the age of 40 increase dramatically compared to the last surge, increase about 54%. So it's really a skewed demographic now that's having a much younger population, almost surely result of vaccination of older folks, and clearly related to variant prevalence in our communities.
Thank you.
Thank you, Daryl. Let's turn it over to Angeline McCall, and if you could introduce where you're from as well, that'd be great.
Hi there. Yeah, Angeline here with Fox 17. I know Dr. Elmucci just talked about this lull and kind of this cycle of the uptick and then the lull again. Obviously, this is spring break for a lot of people. We know that families are traveling out of state, in some cases to high risk areas. What's your concern with that travel? And is there any kind of prediction for what could happen when those folks come back?
Tina or John, do you guys want to take this, or you like me to?
Well, I think go back to when you travel, I think it's just really important that you practice those prevention measures. You're very mindful of where you are, how you're interacting with others. You're wearing a mask, washing your hands, bringing that hand sanitizer, and not gathering in large gatherings. It's one of the questions that we're debating right now is what will be the impact of people returning from spring break. But right now we don't know, where people are going, and we don't know how well they're going to, stay true to these prevention measures. And I'm hopeful that with this continued push, that people will want to protect each other and our community to make sure that we can keep this surge lower and we don't have an additional one when people return.
And Tina, if I could add one thing, because we've had a lot of discussions about this very recently, that what we will likely see in our testing results just across the state, and definitely for us and here in West Michigan, we will likely see a decrease in the number of tests and potentially even then the positivity over the next week or so. What we don't want is for people to get a false sense of security that everything is getting back to normal. That's likely because so many folks are going to be gone for spring break. And the big concern is that, a few days to a week or two after spring break, we'll see a big uptick in that testing again because we have such a high amount of positivity. So I just would caution everybody, the next few weeks are going to be a little bit of an unknown.
Thank you. Let's go to Ehren Wynder for your question.
Hi, thank you, Dr. Elmucci. You mentioned this in passing, but what has been the rate of increase for the presence of the UK and other variants since they were first found in Michigan? And have the current vaccines that we have now shown any effectiveness against those?
Yeah, so great question. And, the state of Michigan actually is doing a really phenomenal job in doing testing for variants. Our state lab does essentially all of the testing, and they do random surveillance testing, as well as we as a provider can say, I'm seeing someone today who just came back from Britain or just came back from South Africa. I'm worried they have the variant. Will you please check this as well? And so if you look on the CDC website, where last I looked, we were about 1,200 positive variant cases. Almost all of those were the UK variant. We're ranked second in the country now as far as variants on the CDC website. The challenge with that is because we're doing more variant testing, we're likely showing that where others aren't. As far as the increase, it's definitely going up. And there was a study just came out of Houston showing essentially a doubling of variants every 5 to 7 days in their community. Surely that same doubling is happening here. So by the time spring break is over, I suspect we will be in the 50+% range, which the CDC predicted by the end of March, early April would be the predominant strain as far as variants are concerned. So clearly a concern for all of us. And it's just the way that these viruses work. And you had a second question that somehow I think I lost track of as well.
Yeah, no, it's okay. I was wondering if our current vaccines, I know they were tested against the Wuhan variant, but do they have any effectiveness against these other variants?
So these vaccines are truly phenomenal. There has been evidence out of Israel for the Pfizer vaccine, where there's been essentially almost the entire society has been vaccinated. looking at different variants and testing, and it's been phenomenal against the variants, particularly the UK variant, which is the variant we're worried about. The Johnson & Johnson vaccine also was tested against these variants and looked quite good. And there's evidence out of the lab for the Moderna vaccine. So I would tell you that if anything, this should cause people to want to double up and go get their vaccine if they haven't, because these vaccines really prevent serious illness and death. And that's what we want to see.
Thank you.
Thank you, Daryl. We've got time for a couple more questions. So we'll go Dustin, and if you could just share what organization you're from as well.
Yes, I'm with Michigan Radio. I just wanted to ask, and maybe this is for Dr. Elmucci because you rounded this morning, but can you talk a bit about how staff is feeling? A lot of frontline staff, not just at Spectrum, but everywhere, a lot of frontline staff got burnt out. Some left the profession because of dealing with the last surge. It took such a toll on people. What is the feeling right now, just a few months later, as we're seeing cases rise again?
Yeah, that's a great question. And I would say it's a little mixed. I think everybody now has hope because of the vaccines. During our last surge, we peaked right around Thanksgiving. That was about 3 weeks before any vaccine was available. Everybody knows it'll be over. All of those who've been vaccinated feel very much safer that in the community, they will not be exposed and get the virus. So I think that's the positive. I think the frustration, which we all feel, is here we go again. We thought we'd likely be done, and this is hopefully the last potential surge before the end. So I think that hope is carrying people along. We've been doing everything we can to support all of our teams, and I think everyone feels it, but everyone wants this to be over. So let's fast forward about 6 to 8 weeks, and we'll hopefully be done with all of this as well.
Great. So we'll go to the last question for Sue Toms, but maybe we can lump in to the answer, the final question about vaccine hesitancy and how we're addressing. But Sue, please go ahead and ask your question.
Sure. I was thinking, Dr. Elmucci, if you want to just say what is your advice for people who have been vaccinated, maybe received 1 dose of a 2-dose vaccine or both doses. How should we live? What kind of precautions should we be taking?
Sure. So actually, the CDC just came out with more updated data from a real-world study yesterday showing that even after 1 dose of the 2-dose vaccines, 2 weeks following the 1 dose, there's likely up to 80% protection. With that said, they really are meant to have both doses done. And so most authorities recommend don't really let up until you're 2 weeks after your 2nd dose for those, or you're 2 weeks after your 1st dose for the J&J vaccine. Ultimately, the problem is we still don't have great data yet on transmissibility. So even though you've been vaccinated, you don't want your friends, loved ones, others that haven't been vaccinated yet to be exposed. So while you might feel much more comfortable going to a restaurant, going out, doing things, just be mindful and wear masks and do all the things Tina mentioned. And that's what we're recommending to all of our teams as well. We still have everyone masked when they're walking through the buildings and so forth. And then as far as vaccine hesitancy is concerned, quite honestly, and I think we'd all agree, this is probably going to be the biggest problem we're going to face. We've been so worried about supply, and as supply opens up, we're going to get to a point like other states have, where they have more supply than they do people willing or ready to get vaccinated. So I think it's contingent on all of us to do everything we can to convince people that this is safe, this is effective, and this is the only way that life is going to get back to normal. And I think very particularly targeting certain communities that have historical distrust of the medical community is really important. And people that have difficulty coming to us, we need to find ways to get to them. And that's why I'm so proud of some of the work that John spoke of. But I think it's going to take all of us to get this better.
Thank you, Daryl. Since we're about at time, I'd like to turn it back over to Tina for some closing remarks.
Thank you so much for joining us. As Daryl and John said, it's just critical that we follow these safety precautions and that people go in and get their vaccine. If you're age 16 plus, you're eligible for it. And so it's really important to get that vaccine. I'm proud of all the work that John mentioned about how do we get to all of our community members to make sure that there's access and that we can help people be healthy. And so please continue to distribute that message about accessibility and eligibility for this vaccine. It is hard. It takes endurance to get to this herd immunity. It takes patience and vigilance. But I'm hopeful that this will be our last surge. And so please join with us to practice those safety precautions to make sure that it is. Thank you for joining us today.
Thank you, Tina, Daryl, and John, and thank you to the media for joining us this afternoon. That concludes our media briefing. If you have any additional questions, please reach out to our media relations team, and have a great afternoon.